Welcome to Soleo Health, where we help you simplify your complex care.
In this video, you will learn how to mix and infuse Factor medication. Once you have received training from a healthcare professional, Factor can easily be self-administered in the comfort of your home.
Storing your Factor is important. Your healthcare professional will review this with you. Storage instructions are found on the pharmacy label. You may also refer to your prescribed Factor manufacturer's product insert on how to store the Factor appropriately and additional information regarding the product. If you have any questions about your Factor prescription, please contact your Soleo Health pharmacist or nurse for support. If your Factor requires refrigeration, remove the product from the fridge and allow it to warm to room temperature for 30 minutes to an hour. Never heat the Factor with warm water, an oven, or a microwave. Wash hands thoroughly using soap and water for at least 20 seconds. Dry with a paper towel. Use your towel to turn off the faucet. With an antibacterial wipe, clean your work surface. Gather supplies on your clean work surface. Sharps container, Factor medication, transfer device, butterfly needle, alcohol pads, sterile water syringe, tourniquet, gauze pad, adhesive bandage, paper tape, optional. Once Factor has reached room temperature, inspect the vials carefully. Verify the product name, dosage, expiration date, and that the glass vial is not cracked. Each dose should be free of cracks, leaks, floating objects, and discoloration. If you have any doubts, call your Soleo Health pharmacist. Now you're ready to mix the Factor. Remove the cap from the top of the Factor vial. Open the alcohol pad and swab the top of the Factor vial. Remove the backing from the transfer device. Connect the transfer device as shown by pushing down on the transfer device until it clicks securely into place on the vial. While holding the syringe of sterile water, remove the cap from the syringe as shown.
Save the cap for later use and do not touch the sterile end of the syringe.
If the sterile end of the syringe touches the work surface or your hands, you can use an alcohol pad to disinfect the tip before proceeding. Attach the syringe to the vial adapter in a clockwise motion until the syringe is fully connected to the vial adapter. Slowly push the plunger of the syringe, pushing and moving the sterile water into the Factor powder. Holding the syringe as shown, gently swirl the vial to mix the sterile water and Factor together. Once the product is fully dissolved, invert the vial with the attached syringe and slowly pull back on the plunger, drawing all of the medication into the syringe, emptying the vial completely. Inspect the syringe for air bubbles. Gently tap the syringe to release the bubbles. Gently push on the plunger to push the air out of the syringe and back into the vial. Disconnect the syringe by turning counterclockwise to disengage. Reattach the cap to the end of the syringe and set it aside for administration. We can now open the infusion supplies in preparation for administration of the Factor. Open the gauze, alcohol pad, adhesive bandages, and butterfly needle. Straighten the butterfly needle tubing as shown. Take the Factor syringe and remove the cap. Connect the syringe to the tubing using a clockwise motion until it is fully engaged. Prime the tubing with Factor by slowly pushing the plunger of the syringe. Stop applying pressure once you see fluid coming out of the needle tip. Set down the medication in the butterfly set so the vein can be selected. Place the tourniquet on the arm above the elbow to help the veins dilate. You can pump your fist or gently tap the veins to help them dilate. Once the vein is chosen, swab the site with an alcohol pad and allow it to dry. Pick up the butterfly needle grasping the wings and carefully slide off the clear protective cap covering the needle. Check that the bevel of the needle is facing upward. Gently insert the needle into the vein at approximately a 45-degree angle, leveling out the needle as you advance while checking for a blood return in the tubing. This will let you know that the needle is in the vein appropriately. Once blood return is established, release the butterfly wings. You may secure the needle to the skin with tape if needed. This is optional. Release the tourniquet. Slowly depress the plunger of the syringe to infuse the factor. Intermittently pull back on the plunger to check for blood in the tubing to ensure the butterfly needle is still in the vein. Infuse the factor slowly at the rate indicated in the manufacturer package insert. Once the factor is completely infused, place the gauze above the needle site and gently remove the needle. Apply pressure to the site to stop any bleeding that may occur. You may apply an adhesive bandage over the site if needed. Activate the safety mechanism over the needle and dispose into a sharps container. Dispose the remainder of the waste into the trash. You can now document the infusion details in your factor journal. Please reach out to your Soleo Health pharmacist, nurse, or prescribing physician for clinical support and advisement.